The topic of the presentation is the effect of the combination of crocin and crocetin for the treatment of triple-negative breast cancer in murine models. Introduction. Triple-negative breast cancer or TNBC. The patients of triple-negative breast cancer lack progesterone receptor and estrogen receptor expression in addition to the human epidermal growth factor receptor 2 amplification. Due to the absence of well-defined molecular targets, triple-negative breast cancer has become a challenge. Triple-negative breast cancers have a more belligerent clinical course, lower survival rates, poorer prognosis, and higher incidence of metastasis than other forms of the breast cancer. Chemotherapy is still considered as backbone of the therapy against triple-negative breast cancer, but due to the lack of recognized molecular targets, the chemotherapy treatment of the TNBC or triple-negative breast cancer proves to be more challenging than the other subtypes of the breast cancer. Due to the toxic effects of the chemotherapy, the natural products with biologically active compounds can be used as an alternative and effective treatment to avoid or inhibit the progression of the breast cancer. Anti-metastatic potential of the carotenoids of the saffron. The carotenoids of the saffron which we are going to talk about are mainly the crocin and crocetin. The scientific name of the saffron is Crocus sativus. Saffron has antioxidant and anti-tumor properties, so it can be used as an effective treatment for the breast cancer. Crocin. It is a carotenoid of the saffron and it is essential carotenoid of it. It shows anti-angiogenic effect on the breast cancer cell MDA MB231. Crocetin, the bioactive carotenoid of the saffron, it shows anti-cancer and antioxidant properties. It affects the growth of the cancer cells by hindering or inhibiting the growth factor signaling pathways such as WNT pathway and averting the nucleic acid synthesis. Crocin and crocetin, the carotenoid of the saffron, shows anti-metastatic effects on TNBC or triple-negative metastatic breast cancer cells by suppressing the target genes of the pathway called WNT or beta-catenin pathway. In this study, we will use an effective combination of crocin and crocetin having the anti-metastatic properties on 41 breast cancer cells, and later on a mice model of the breast cancer will be evaluated. In addition, the effect of this effective combination of crocin and crocetin on the pathway called WNT or beta-catenin pathway will be considered. Aim of study: the anti-metastatic potential of combinations of two bioactive carotenoids of saffron, which are crocin and crocetin, on 41 breast cancer and on a murine model of triple-negative breast cancer will be determined. The effect of this potent combination on the WNT or we can say beta-catenin pathway will be assessed. So the crocin and crocetin combination is a natural product which lacks the adverse effects associated with chemotherapeutic agents. So it will be more effective than the chemotherapeutic agents for the treatment of triple-negative breast cancer. If we talk about the hypothesis, If the combination of two bioactive carotenoids of saffron, which are crocin and crocetin, they shows the anti-metastatic potential on 41 breast cancer cells, then it can be used as an effective treatment for the triple negative breast cancer. Literature review. If we talk about the cancer is a dangerous and deadly disease. Breast cancer is the second foremost reason of the death worldwide. Early stage of the detection may help to cure or increase the lifespan of the patient. All over the world, higher than 1 million women diagnosed with breast tumor. Men are also having some breast cells and tissue that have possibility to form breast cancer. There are several factors associated with breast cancer such as diet, gender, old age, consumption of alcoholic beverages, family history, a first child being born at an old age, etc. Gene expression studies using DNA microarrays have identified subtypes of breast cancer. 4 common subtypes have been identified: basal-like and HER2, and 2 are derived from ER or estrogen-positive tumors. The basal-like category called triple-negative breast cancer that are negative for estrogen receptors or ERS, progesterone receptors, and human growth factor receptors are called HER2. Triple-negative breast cancer patients endure lower survival rates than the women with other subtypes of breast cancer.